Western Cape Premier Alan Winde is about to brief the media to give an update on the COVID-19 situation in the province. Premier Winde will be joined by Western Cape Health MEC, Dr. Nomafrench Mbombo, and the head of the Department of the Health in Western Cape, Dr. Keith Cloete. Let's cross live to that virtual briefing now.
We need to give them the reprieve that they need over the next while. And Dr. Cloete's presentation specifically is going to show you the kind of pressure that our health system is under right now. If I go back to the last Digicon, between then and now, we have had the announcement from Dr. Keith and Professor Karim about this new strain of the COVID-19 virus 501v2, the strain that we are finding developing here in South Africa, as well as in other parts of the world. And first of all, that strain, as you will see in this presentation, mutates far quicker. You need far less of this virus to pick it up. So it is much more aggressive in the spread. And we can see it in our system, and you will see it in this presentation. Obviously, as the infections grow and as the pressure on our health system grows, our health department have to make more and more really tough decisions on a daily basis. I think nothing as much as Dr. Mendelssohn's article that I've just read that is out on News 24 at the moment. You just read her letter that she's written to the public here in the Western Cape or the city of Cape Town, explaining what it is like to be a frontline health worker right now. And I think nothing more than saying to us as citizens in this province, we have to make sure that we step up. We have to make sure that we play our part even stronger than we have been up until now. The medical system, as you will see, are making many big choices. They are making choices around the catch-up that we were getting right after we saw the first curve come down. We are now cutting again those visitations to our hospital systems. We are now pushing out again those outpatients or not so urgent visits to our hospitals or those surgeries. We're pushing them out. We need to make sure that our hospitals have the space not only for you when you or one of your loved ones do catch this virus and you need to have that special care that our hospitals can give. Or whether you have an accident, whether you have a heart attack and suddenly need medical care. Right now, our hospital systems are under threat and under stress. So we all need to be playing our part. When you speak to our healthcare workers, we need to help them specifically with trauma. Because as we've said in a number of times before in these Digicons, the trauma aspect, which really takes a lot of resource in our ICUs, these are where people abuse alcohol. This is where we have car crashes. This is where we have knife and gunshot wounds, where you have to drop all your resource in our ICU centers to help the citizens that need that help at that specific time. We need to drop those pressures on our trauma systems, and that is from alcohol use, that is to what happens on our road systems, that is making sure that we give that space to the health system. But we also need to understand that this season, and specifically this week ahead of us, it is about gatherings, because where we gather is where the virus spreads. We need to make sure that we are not gathering in numbers. We need to make sure that where we move, that we move safely. You will see in the presentation, Dr. Cloete speaks about the bubble in which you and your family operate in. Keep that bubble as protected as you can. Careful this season where you invite other bubbles in to join your bubble, or someone leaves your bubble to go to a shop and then comes back. You understand that there's risk in the system. We need to make sure that we wear our masks. We need to wear our masks properly, not under the nose or as a chin warmer. We need to make sure that we are outdoors. If we keep our functions small and we keep them outdoors, we minimize risk. We all have to play our part now more than ever before, because that health system needs to be protected. We owe it to those frontline workers who are out there every single day playing their part. The least that we can do as citizens is play our part. Thank you. Back to you, Kayla.
Thank you very much, Premier. So we'll now hand over to Dr. Nomafrench Mbombo to make her remarks. Over to you, Dr. Mbombo.
Thank you. Just to piggyback on what Premier has indicated, at least during the first wave, we had something to share the staff with. We had Jerusalem. You can't, even now, if you could play Jerusalem, and no one will ever feel so cheerful about it, because it's not only about who are in the second wave, but also with the variant that is happening there, and also because there's no lockdown. Everyone is roaming the street. So the purpose of this DigiCon, most important, is about how we protect our health workers, because we don't have a Jerusalem that will be able to cheer us up. And also because it is the festive season, which comes up with all of its challenges, the trauma, the interpersonal violence, the food poisoning, the drowning, and all of those. And you must understand that this is not about economy versus health. It's about the issue of the socialization and also to protect our health system so that we could be able to survive. When all the airlines closed, 16 or more of them, after they heard about the variant, not only for the UK, but also for the South Africa, one may argue and say that, what about the profits? But they didn't prioritize the profits. It was about prioritizing their staff, because they will never be able to live with it when they find that their staff are highly infected, irrespective that there is no evidence or proof at this stage whether the variant is deadly or not. When the Prime Minister of the UK immediately introduced the Tier 4 of the bubble of the London and the Southern and the Eastern, during the Christmas, and reducing the number of the households within those communities. In as much as that people will have said that we have planned a lot to spend more time with the Christmas, but in order to protect the health system, because the major aspect there was about where the whole area of Kent, when the health system was failing. And the governor of California, irrespective that even their positivity rate, and there's no variant there, is around 12%. When they introduce stricter measures in regard to contain the virus, because when they say that we are only left with 15% of the beds for the critical care for the whole of California, therefore we have to protect our health system. Nobody queried. When Angela Merkel from Germany, Macron from France imposed the restrictions, when she said there is no mercy, the issue is about first thing first. When you are an organization, you start by protecting your own staff. It's the same thing with a battle. When there is a war, when the generals say that whoever is in charge, the commander in charge, now we have left with so many troops, or the troops are tired. Now we need at least to pause and regroup. You have to listen. So what we are saying, under the circumstances, our health system is fragile. We can build as many other beds, which is what will be presented, but the beds need faces, and the faces need the hearts, and the hearts need the hands. Those the three hands, the hands, and the face, they were there during March in the first wave, but now they are exhausted. Remember, you and I have been in a privilege in the sense that we are conducting this virtually. The parliament has been closed forever, recently opened. Some of you in the government, also even the media space, have had an opportunity to stay in home and work at home. But you must understand that the health workers, they never stayed home. They've been there since 2nd of March when we spoke about our readiness for this. So you must think about the health workers, because they are first-line defense. If everything could collapse now, it will mean that they will be asking for volunteers for all health workers to assist. Even there will be the last defense if anything could happen. So that's why we are saying to you that in as much as that the issue of the social distancing, physical distancing, and protecting the economy has always been there, but we will never be competing in that space. We were busy doing our own thing as healthcare system. But now we are appealing to you. Prioritize us. If you cannot do it for yourself, just do it for your healthcare workers. Because some of them, They won't even be able to spend Christmas with their families because they'll be there working hard in order to protect you. Thank you very much.
Thank you very much, Minister Mbombo. So we'll now hand over to Dr. Keith Cloete to provide us with his response.
Thank you very much, Kayla. Thank you, Premier and Minister. Kayla, can everybody see the slides? Is it slides up?
Not just yet. Yes, I can see it.
Okay, so thank you very much. I will be doing an overview of very rapidly our 5-point resurgence strategy, what we're doing in terms of surveillance and response, but then very importantly, what the health platform COVID capacity looks like now and what our plans are, and then scaling down the non-COVID capacity, then safeguarding the well-being of our healthcare workers, a very brief note on a vaccine strategy, and then festive season messages. The 5-point plan, just to remind everybody, the first one is to change community behavior to prevent infections in the first place. The second one is surveillance and outbreak responses. That's when we detect the cases and we see where the pockets are and we respond. The third one is scaling up the health platform COVID capacity to respond to COVID disease. The fourth one is to maintain some vital comprehensive services, but actually scale down quite a bit to allow for COVID. And the last one, probably the most important one that Minister Mbombo refers to, is to safeguard and protect the well-being of our healthcare workers. Under the first big heading, the changing community behaviors, we maintain a very strong and bold central public messaging that you hear from the Premier and the Minister today, which will be followed up and continued right through this period with targeted local messaging in terms of impacting on COVID and on the healthcare system, with coordinated law enforcement and environmental health practitioner through a provincial and district joint operations centers. I will go into the surveillance and outbreak containment. At the moment, we're looking specifically at places where we can make a big difference, and the daily huddles continue where people then give us feedback of where things are. Then there's ups the scale of the healthcare platform. It's about the capacity in each of our areas and what we're doing to bring more capacity online. And then scaling down the COVID capacities, the big message there is we need to scale down everything else to allow for COVID. And one of the biggest challenges is the alcohol-related trauma. And the last one is to look after our healthcare workers. So on surveillance, the picture that we've been sharing with you is now a very distinct second wave that is significantly higher than the first wave in the Western Cape, with increased use of oxygen, increased hospitalization, increased reported deaths, increased case positivity rate. The overall picture in the province, we see now figures way above what we saw in the sharply increased since the middle of November for the last 4 weeks. Hospitalizations has now exceeded the peak of the first wave, and deaths are increasing rapidly. The metro overview, we've seen sharp increases in every geographic area in the metro, and literally every area except in Kailicha has exceeded their first peak. If you look at the rural overview, all rural districts have now exceeded the maximum daily case numbers of the first week. And in the garden route, we're starting to see the first signs of stabilization, but the absolute numbers remain high, but it is starting to curtail. We continue to triangulate with wastewater, and this is now at the City of Cape Town wastewater plants, and also in Breda Valley, and for the last 2 to 3 weeks, also in Overberg. And all of this just shows us where the cases are increasing. In the wastewater, we also notice increased concentration of COVID in the wastewater. The net reproductive number, that's the one that every person that's infected, how many people will they infect? At the moment, it stands at 1.3. There is evidence that it is starting to flatten for the province overall, but at 1.3, we're still generating quite a lot of new cases. Then the news we all had last Friday, that when we had in the first wave, we had what was called different variants or lineages of the COVID virus. And for the majority part of us in the Western Cape and the country, there were 3 very clear lineages that was responsible for the first spike in the country. Obviously, Western Cape first, and then the others in a sequential fashion. What has emerged from October and has now given us explanation of what has happened in the Garden Route for us is that there's a new dominant lineage. It's a new variant. We've also done the sample in the Cape Flats, and we can now say with confidence that this variant is gone faster than the other variants, and that to some extent explains what's happened in Garden Route and what's happening in the rest of the Western Cape, and what is happening in the Eastern Cape and going on to other provinces in the country as well. So the reason why it spreads faster is that the mutations of this vaccine is that it binds with the human cell easier. So what does that mean? It means that you need smaller amounts of the virus to become infected. So your contact with smaller amounts infects people now, whereas with the other variants, you needed higher amounts to become infected. So what do we and what don't we know about this variant called 501V2? We know that it's unusual for a new variant to contain several mutations. It was explained to us last week by Prof. De Oliveira and Prof. Karim where these mutations came from. The second thing, it is being reported in other countries, similar variants, not the same variant, similar changes, and that is what the UK has reported clearly over the last 10 to 15 days. There are early signs that this new variant is spreading faster, sometimes faster than the first wave viruses, so we can attest to that in the Garden Route and in the rest of the Western Cape. It is widespread, and it's probably across most of South Africa by now. What don't we know, and it's not useful to speculate about this, is where did it come from, why did it happen, why in Nelson Mandela Bay? The scientists will give us the answers. Is it more severe? The clinicians on the front line will tell you they see more younger people and they see more severe disease in younger people. The question is, are we just seeing more cases and that the proportion of younger people are coming in is more than it was the first time? Or is there a suggestion that this is a more severe disease? We do not know at this point in time. Is it reinfecting people who got infected in the first wave? That means if you had COVID before, are you protected against this variant? We don't know yet. There is no evidence to suggest that it's not, but we don't know yet. And then probably the $1 million question is, will the vaccines that is coming online work against this variant? And again, the scientists will have to guide us which vaccine, if any or all of them, will work against this variant. So this is our daily huddles, then just as a quick check-in. And this is a practice that's now been institutionalized, and it's a very rapid overview. But the big picture is there's increasing case numbers everywhere in the province. All the teams are dealing with the increase of cases, but then what comes with increase of cases, increase of people that requires oxygen that comes to our facilities. Therefore, the cases are increasing everywhere. And therefore, because more people are also coming to hospital, more people are starting to die. So the death rates are increasing. But the detail is there for every area. Then to come to Garden Route specifically, we can now say for sure that we are starting to see a decline in active cases in the Garden Route. And it's mainly due to the decline in the 3 biggest sub-districts in the Garden Route, or 3 biggest municipalities, which is Bito, George, and in Bito, George, and Knysna. So in those 3 areas, there is evidence that the cases are coming down, and also evidence that the hospitalization is declining. There are smaller areas that is a little bit more removed from those three. They are Hessequa, Kannaland, Mossel Bay, and Oudtshoorn, and they are still showing an increase in cases, but overall the picture is one of stabilization. So coming to our healthcare platform. So the big issue here is the primary care platform. That's all your community health centers, and that's where Dr. Mendelssohn wrote her letter, open letter to the citizens of Cape Town to News 24/2, is that increased demand of COVID testing and the need to triage sicker patients to say, should they get oxygen? Can they stay at home? Should they go to a hospital? That is what happens on our community health centers or our primary care facilities. They had to also systematically de-escalate other services to be able to cope with these numbers of people coming in for COVID. The big pressure point is the hospital capacity. We have 5,244 total acute public sector hospital beds where COVID potentially can go into. Because if you take away maternity beds, neonatal beds, pediatric beds, and psychiatry beds and TB beds, that's what you're left with. And also 135 total critical care public sector beds where COVID potentially can get into, but it is competing with other things, COVID competing with other conditions to get into that same critical care capacity. And then we have brought online we're bringing systematically online 613 additional intermediate care beds in the metro. 336 are already in Brackengate, 90 at Lentegeur, and we're bringing additional 187 beds on board at the Lentegeur site as well. The team and ourselves are currently looking at additional capacity beyond that to bring more on board as in light of the numbers that are starting to become clearer to us in terms of what we expect over the coming weeks. The fatalities management, that's really how to deal with deaths and bodies. In the metro, we have capacity for 240 bodies in one place, and that there's a work group that's now coordinating as the deaths increase, the management of bodies across all the municipalities in the rural areas as well. The testing has increased quite significantly. There is now this antigen testing being used in Garden Route and Metro, and we are starting to use that now in the hospital. So one of the big things is that antigen test can give you a result. It's the one that is used on the airport. It gives you a result within an hour. If we start using it in hospitals, it helps us with the category that we call persons under investigation, because it helps us to make a distinction of somebody to confirm the diagnosis. And we are looking over the next couple of days, within the next week, to get this in each of our hospitals, working with the National Health Laboratory System. If we then look at hospitalization, so what is currently admitted for SARS, for COVID in our province, you can see on the left-hand side, the whole province, the light green bar, solid bar, is all the current admissions for public sector. And that for COVID positive has exceeded 1,400. You can see we stopped short of just between 1,000 and 1,200 in the first wave. We are above 1,400 and still increasing, 1,500 and increasing. If you look at the dotted line, that's admitted currently or overall for private, that's also above 1,200. Whereas in the first round, the private sector at the peak admitted 800 people for COVID. This is 30% more for the private sector as well in terms of admissions. The dotted red line is ICU for private. Again, they are more than it was. It was about 200 at the beginning and the first wave. They are close to 300 in the ICUs now. And then you see the public sector, which is at the same capacity. And our public sector capacity is the one constraint because there's competition for those same beds with trauma. And I'll come back to that specific point. If you look in Cape Town then, we can see now, that is the overall picture for the province. Cape Town, we are now starting to exceed the hospitalization we had in the first wave. And it is still increasing, and we expect it to increase still for the next 2 weeks. And that is the big message we're bringing to you today, is that the platform in the Cape Town is already under pressure. We expect it to become under even more pressure. That's why we need a radical intervention here of changing something that can safeguard the healthcare platform, both for the public and the private sector over the festive season in Cape Town. What we are doing, and we've been working with our scientists on this specific thing, they're looking at not modeling on the basis of theoretical modeling. Now that we know that we have this variant, they're looking at the experience of Nelson Mandela because it went first, and they look at the experience of the garden route. And based on that, we're now modeling what is the expected pattern to be in the metro. And it's on that we're saying for the next 2 weeks, we need to create additional capacity in the public sector and in the private sector to be able to cope with what's coming at the next 2 weeks at us. The overall hospital admission, therefore, by health district, metro is where it is, where in the first wave, Cape Winelands, Central Karoo, Garden Route, Overberg, only West Coast is below where it was in the first wave, and Garden Route is starting to come down. The big challenge of all of these is the trauma load in each of these places to compete with the space for COVID. So in general, there's the 2,691 COVID patients that I spoke about. It's 1,500 in the public sector, 1,100 in private sector as we speak. This excludes the people under investigation, which also takes up additional beds. And then also that we have in the public sector specialized hospitals, all the hospitals that I spoke about, maternity, pediatric, neonatal, psychiatric, TB, there's also some COVID patients in those settings. So that number that you see there excludes those two numbers. The COVID hospitalization have increased sharply, and there's also significant pressure with trauma and psychiatric pressures. The metro hospitals currently as a collective is running at an occupancy rate of 105%. That means they're running above capacity. In George Hospital drainage area, they're running at 90% capacity. In the Paarl Hospital drainage area, it's 93% capacity. And in Worcester and its drainage area in its hospitals is running at 87% capacity. So if you take the COVID plus the PUI cases, it currently makes up more than 30% of all available acute bed capacity, metro and rural drainage areas. The Hospital of Hope, which is that hospital was brought on, is currently at 282 patients, but we effectively are running it at full capacity now because more patients were admitted. Soonstraal in Paarl has got 20 patients and the 27 TB patients, which we're about to move to Brevelskloof to open the capacity of Soonstraal to go to 60 patients. And the oxygen utilization now is running at the all-time high of 58.5% daily available capacity. And our bodies is 53 bodies in the mass fatality center in the metro. If we then look at this acute availability, I'm going to go through these quickly. I said about 105% occupancy in the metro. You can see the distribution of that. I just want to highlight a place like Mitchell's Plain Hospital, where there's been severe pressures over the last 4 to 5 days, running at 115% capacity. Somerset 133% capacity, and Kailicha 140% capacity, with other varying capacities. So what does this mean? It means that hospitals themselves have created additional capacity over and above what they are actually operating within to add additional beds to accommodate more patients. In George, you can see the George drainage area. George is coming and reducing, and you can imagine it's running at 107%. So it ran even higher, like Oudtshoorn is running higher, and especially places like Knysna and Riversdale Hospital running above the capacity because people are bringing additional bed capacity online to cope with what's happening and coming at them. The same with Paarl. Paarl is running at 125%, and you can see the other hospitals on the West Coast, which are not quite there yet, but the increasing admissions are starting to happen in the West Coast. And then the Worcester Hospital and its drainage area, specific pressure in Caledon and in Montague Hospital in the last 3 or 4 days. And again, Ceres Hospital also 99%. So the pressures are all over the province, not only in the metro. Oxygen capacity is running at 58.5%, as I said, and I'm going to quickly show you this. In rural, as you can expect, the big oxygen capacity utilization has been George Hospital. It's gone to a peak and it's starting to come down. But as the hospitalization is still there, it will lag a little bit behind the cases. And you can see Worcester and Paarl starting to increase. In the metro, the big outlier and the big increase that went up here over the last week was Mitchells Plain Hospital, followed by Somerset Hospital. And we've taken out Grootske and Tygerberg because they use much more oxygen than the other hospitals. And then just lastly, in terms of oxygen, if we measure it in terms of tons of oxygen use, at the first peak, we used 27 tons per day at the maximum. We're currently using 32 tons of oxygen currently, and it is increasing over the coming days and weeks. So scaling down the non-COVID things, the biggest challenge is the alcohol-related trauma, especially the impact it has on emergency centers and on critical care. That's the two areas where alcohol-related trauma is impacting on our ability to respond to COVID. The impact of the new alcohol restrictions and the targeted law enforcement will be monitored over the coming weeks. And the new alcohol restrictions have only been in for about 7 days since last week. And the psychiatric pressures has also necessitated us. We can't really not treat psychiatric pressures. And we obviously have to de-escalate everything else to be able to cope with that. So this is what we showed you last week, but we're adding what has happened since the 15th of December, since the restrictions were reinstated. So we know from every relaxation of the alcohol restrictions that there was increase in trauma in the hospitals. Since the 15th, we normally would have expected by the 16th a big peak anyway. There seems to be a leveling off, but the impact has not been massive in reducing since the alcohol restrictions. And this graph shows it better. A week before the restrictions last week, the median was 128 cases. The median in the week after the alcohol restrictions came in went to 160 cases. But that is primarily due to a very high peak on the 16th and 17th. And the alcohol restriction wasn't in place because that was a Wednesday last week. But if you look at the weekend, which is the 13th, the previous weekend compared to the 20th, there seems to be a weekend decrease, weekend on weekend. It's early, but we have to track and see what's happening in terms of that. Can we then say that the big issue is the safeguarding and the well-being of healthcare workers? The biggest challenge is the increasing COVID infection rate amongst healthcare workers, and that the impact it has on that the healthcare workers have to isolate and quarantine. And then the additional workers available so that we can bring people online with contracts and agencies as people become ill, and the volunteers putting their services forward. And then having sufficient PPE, and then probably the biggest strain is the mental well-being of our staff while they go through this repeated trauma. This is our healthcare worker infections. We now currently have 761 active cases, 58 admissions, and 5 deaths over the last 14 days amongst healthcare workers. And this is our dashboard for the top 20, and it just shows that the bigger hospitals are starting to get more infections of people. We've broken it down. That 761 healthcare workers is across 94 institutions, and it equates to 2.3 of our total workforce. And since the beginning of March, 7,200 staff, almost a third of our staff, have taken COVID-related leave. That totals 36,000 days that healthcare workers have been out of the system, an average of 5 days per case, ever since March in the beginning. You can see the big impact. The more COVID increases, the more healthcare workers are away from the workplace because of infection themselves. And this is then our staffing strategy. We're currently looking at 44% of the people we want to employ, and we're looking to employ 1,327 nurses, bringing them into the system. 44% of that is to office people that's on short-term contract extensions, and really to keep people that's on community service, and to actually keep them in our system. The second 56% of that 1,300 is to bring people on through recruitment and appointing them. Again, it's early commencement and new intake for ComServe and placement of bursary holders. This is specifically for nursing because we found nursing to be the key rate limiting step in our ability to render services. And then there is an official request for the military to add specifically additional staff members into our system. The vaccine strategy, very quickly. There is a need, and it's become very evident and obvious now, that we need a proactive strategy to start accessing or have access to SAPRA-approved vaccines in the Western Cape. Minister Mbombo has started, and we will be engaging the National Minister on this matter. We have technical experts advising us on the formal option appraisal of these available candidate vaccines, and it's also obviously linked to the SAPRA approval. Prioritization will be a big issue. Healthcare workers and other essential workers, and then the vulnerable groups, especially the elderly and people with comorbidities. And in the demand forecast, we have some estimated numbers for vaccines required per prioritized category, and we're doing the cost estimates and confirmation of the budget. So the next steps is very concrete in terms of SAPRA approval, getting the sourcing and distribution strategies so that we can provide vaccines as early as possible in 2021. Then the festive season messages, just to reiterate that these are the key things. Coronavirus is in the air. So the big issue is we need to be careful about sharing our airspace and keeping our distance, ensuring good ventilation and wearing a mask. Also, previously gatherings were limited because we were in lockdown 3 the last time we had a peak. Now social gatherings is everywhere, and it substantially increases transmission. So what can we do? We can avoid large gatherings. We can limit its size. The more people, the more risk. We can keep them shorter. The shorter you stand with people, the less risk. You can go outdoors. If it's outdoors, you have a smaller risk. And practice distancing, masking, and respiratory hygiene. So this is the science that lies underneath this. We know these studies, and the studies prove that you're 18 times more likely to contract COVID in an indoor setting with people. And this study is a very good study that was published, a Japanese study. It shows of the people that were in an indoor setting, right? Only 6 of the 22 people who met people indoors did not infect anyone. Whereas if you go to outdoors, 77 or 88 people who only met people outdoors did not infect anyone. And that is where the 18 times likely infection from an indoor setting is compared to outdoors. And then the last one, and that's really the key message for all of us, for everyone. It starts with ourselves. This is a message to every single citizen. Keep your bubble safe. Have the safest Christmas that you can have, the safest festive season. And what we mean by a bubble, each dot in that bubble is a household. Now, if you know 1 or 2 other households that are secure, that's your bubble. Don't go outside that bubble. The message at the bottom is, if you start crossing bubbles, and the big point is, if somebody is in your bubble and is in contact with somebody in another bubble, but every time they're in contact with somebody in another bubble, they are in contact with every person that person has been in contact with. You introduce cross-infection into your bubbles. The fewer people you see, the safer we all are. Don't create a chain of infection by overlapping the bubbles. So in conclusion, we have an increase in active cases. This is a much bigger second wave than the first one. We now have, in a sense, the variant explains that phenomenon to us. Our local teams are tired, but they're still trying to figure out how to pick up infections and then focus on the vulnerable, especially people in old age homes. The non-adherence to protective behavior is still the big issue. So the message about avoiding crowding, staying to a bubble, and not spreading the infection must be the key message through law enforcement that we need as well. Then hospitalization is rapidly increasing. We've activated things to scale up, but the trauma and the alcohol-related trauma is still a major challenge. Our healthcare workers are under significant strain. The voices of the healthcare workers has been one of a desperate call because of where they find themselves. And that desperate call we're trying to convey to the general public today. Please look after our healthcare workers so that we can look after the healthcare system for everyone. And the strong focus to change behavior for the next 3 to 6 months until there's clarity about the availability of the vaccine. Thank you very much.
Thank you very much, Dr. Cloete. So we'll now move on to the question and answers portion of this DigiCon. We have already received some questions, but I'd like to indicate that any journalists who have questions, please raise your hands and unmute yourself when we call you. We'll take questions in rounds of 3. So the first question that we've received is from Kaylin Palm, EWN. Her question is directed to Dr. Cloete. She has 4 questions. Her first is, are there plans to recommission the CTICC hospital? If not, what are the plans to deal with the overflow, given the numbers are worse this time round? The second question is, What are your models saying about where the province will peak? About where the provincial peak will be for this wave? Are you worried about hospital capacity? Her third question is, please give us a detailed rundown of your stock levels for PPE. And her fourth question is, when will the Western Cape do what the Eastern Cape did and ask for restrictions of some kind? So Dr. Cloete, I'll allow you to answer those questions and then we'll move on to the next round. Thank you.
Thank you, Kayla, and thank you for those questions. Just to clarify, with the CTICC, the CTICC was used as part of the first wave. We were in lockdown 3, lockdown 4 coming down to lockdown 3. Economic activity was curtailed at the time. The CTICC did not do what it was intended to do. It could not hold conferences. So at that point in time, we had a contract with the CTICC to use it until such time as the CTICC must resume its normal business, which is exactly what started happening when the lockdown levels coming down. The CTICC is designed for conferences, it's designed for activities, and that's why we decommissioned the CTICC. Our plan is, and that's what I tried to explain, at the height we at best used about 400 beds of the CTICC. What we plan for is to have 600 additional beds, 338 in Brackengate, and bringing additional capacity online at the Lentegeur Hospital Centre site. So that is the 600 beds, if you like, that would have been of the CTICC in the metro. What you saw, there's pressures in the metro, and we are going to go even beyond that 600 beds by looking at every single other possibility of creating beds. You saw each hospital bringing this additional beds online, and that is our strategy. But you must also remember, there is a George drainage area, a Paul drainage area, Worcester drainage area. All of those also had to get additional capacity, and that's why we're using the infrastructure of the healthcare platform as an investment case for infrastructure that we can use afterwards. So I just wanted to very clearly explain, we're not going back to the CTICC, but the concept of creating additional beds is very much still part of our strategy. The big rate limiting step, though, is, which I show you here, which is exactly what we had at the time of the CTICC, is the availability of staff. It's one thing to have a bed, it's one thing to have the oxygen, it's another thing to have somebody that can staff it. And in this case around, the staffing is more even acutely affected than it was the first time around. So that is the combination of that. We expect, according to the modeling, by applying what has happened in Nelson Mandela Bay and what's happening in Garden Route, we expect in the metro the peak to be towards the first week in January. So we are currently about 16 days or 17 days away from an expected peak in terms of that. So that is what we're working with. We are worried about hospital capacity. That's why we're making the call on things like trauma and alcohol-related trauma, because that is one of the big things. If we can have better behavior around alcohol, then we can have less strain on the healthcare platform. Therefore, we can cope with the more COVID that's coming in relation to that. The PPE stock levels are available. We've been keeping a daily dashboard on it. All our PPE supplies are sufficient in quantity. There's a specific challenge that you would have noticed in the media, and that is the use of KN95 masks. UCT has found that the KN95 masks, many of those were donated to us. When they tested, they found quite a few of those samples weren't protecting healthcare workers effectively. We have now independently tested all the makes we have. We have 9 different makes. We found 6 of them not to have protection with an independent laboratory that does this testing, and only 3. So we're removing the 6. So the 6 that is not safe for use in a high setting from a N95 perspective. But each hospital has got its quantity, and our stores has got the quantity, and we are moving and replenishing our stores accordingly. In terms of asking for further restrictions, I will refer that question to the Premier. because it's not the health department that actually imposes restrictions. Thank you.
Thank you. Thank you very much, Dr. Cloete. Maybe if I can also, just before I get to restrictions, just also add, I'm watching the questions coming in from social media as well. And a lot of questions linked to what you've just said around the CTICC. But in total, remember, it's the manpower on the one side, but also the existing CTICC that was decommissioned, those beds went to the other facilities, and there are 690 beds in field hospital type beds across the province that have been expanded on. So that equipment was not lost. It was actually utilized in the other field hospital areas across the province. Then with regard to further restrictions, obviously these are the things that we've got to look at. We are at the moment dealing with already a further restriction in the province or in the country, as well as a even further restriction in the garden route at the moment, and we will continue with discussions at a national level on those restrictions. But we will also be having a look, and at the cabinet meeting this morning, we also had a look at what are the other areas we could look at. If I think about the faith-based organizations, so we already have an agreed faith-based organization meeting. We've got Christmas coming up, and how do we minimize gatherings there, just as we did during Easter. So those meetings I think that first meeting takes place tonight with all faith-based organizations. We are also engaging through our economics development department, malls and any businesses where gathering takes place. How do we up the stringency of entry and exit? And then, of course, perhaps at the same time, also saying in the last slide of Dr. Cloete is talking about the bubbles. When you, as a citizen, are going to go to a mall, remember you've left your bubble, your protected space wherever you live, and you've now sent someone, hopefully one person, to a mall. It does not make sense when a whole family goes to the mall, because then you've all broken that bubble environment. And so really it is about using common sense in this space, making sure it's smaller, making sure it's outdoors, and making sure that we're protecting ourselves. But just ending off on those further restrictions, of course, we will continue with monitoring, number one, the existing restrictions and how they have had any effect, like you saw in the presentation on alcohol and the link to trauma, because we've said that trauma beds specifically take a lot of resource, and we need to make sure we've got space for your loved one when that trauma case is really necessary, or that trauma bed is really necessary. But we will continue with engagement and monitoring of existing levels in level 1A, B, and also whatever further restrictions are necessary.
Thank you very much, Premier. So we'll now take the next round of three. Linda Insel, I see your hand. Linda, you are muted.
Sorry. There have been reports that private sector hospitals have had to transfer patients to the public sector because of a lack of capacity. Could you perhaps update us on the situation in the private sector if you have that information? Thank you.
Thank you, Linda. So we'll next move on to Mwangi's question. Mwangi's question is for Dr. Cloete, and it asks, does the department have any idea why Kailicha has not matched the peak of the first wave? Is there anything they are doing that is different from the rest of the country and which we can learn from?
Thanks, Kayla. So just on Linda's question, Linda, yes, I showed you the hospital capacity of the private sector. So in the slides, as I gave you the public sector capacity, I also showed that the private sector capacity is a third higher than they were at the peak the first time. So the hospitals are under severe pressure in the private sector as well. So we have had reports of patients being redirected from the private sector hospital into public sectors hospitals. We have established communication with the private sector so that we have a coordinated process. Where they have capacity, we will refer to them because we have contracts and SLAs in place with them. Where they don't have capacity and they need to refer to us, that it is in a streamlined, coordinated way in terms of that. And then Mongi's question about Kailicha. At this point in time, the Kailicha numbers is lower than the others, and we are watching the Kailicha numbers. We would not like to speculate, but you will remember that in Kailicha, there was significantly a high burden in Kailicha the first time around. It was one of the highest burdens in the metro. And at this point in time, it might seem that, let's call it some form of immunity from the first wave might be the factor that influenced, but we don't know enough to be able to explain. So it is important that we actually examine and see what exactly the reason is for the lower experience in Kailicha the second time around. Thank you.
Thank you very much. So our next question is from Earl. Earl has asked, to the Premier, we've been told to wear a mask, sanitize, practice social distancing for 9 months, and many still don't adhere. To help with the pressure our health sector is facing in the Western Cape, we brought stricter measures like closing beaches for the next few months. Unfortunately, we can't take further questions due to time constraints. Over to you, Premier.
Thank you very much. Thank you very much. Specifically about closing and opening, we are definitely very, very clear that we need to open up outdoor spaces. We're saying to you, you need to be outdoors. So the closing or the rationale between closing of beaches, especially on the garden route, did not make any sense at all. And of course, that is a separate process that's being entered into right now. But because we believe that you should be able to be outdoors. I think also another thing about saying, so should we close down all the beaches? We need people to be on the beach or in parks or in open spaces rather than in malls or in closed spaces. We've seen the slide that says, outdoors versus indoors. You have an 18 times greater chance of contracting this virus indoors. And that's why we've got to be really, really clear on that message. It's about small and it's about outdoors and it's about protecting yourselves in your bubble. So if you're going to the beach, that's a safe place to go, but make sure that you're staying in your bubble. If you're going to the mall, I've already explained that, because your risk is higher at the mall than at the beach. It's and I mean that message is very clear from us. It's about open and small and outdoors versus about closed and congregated areas. Thanks, Karen.
Thank you, Premier. So I just want to bring in Minister Mbombo to contribute. Over to you, Minister.
Okay. I just wanted to again to clarify the issue of the types of beds. The CTICC, the main focus was offering intermediate care beds, which is the field hospital, and also we added fewer palliative care beds and also very few high care beds. But the main focus was intermediate care, which is a step down, so that when people have been admitted at an acute hospital, which is where they utilize their beds, and then they've been stabilized, but they are not ready to go home, they could be able to go to the CTICC as an intermediate care before they are being discharged. The other intermediate care beds was Bracken Gate, which we also added some fewer critical care beds at the time, plus also some palliative care beds. Toussaint, which was also part of the intermediate care bed, which is currently Herrico May in the garden route, also has got the critical care beds. And in Tygerberg, also at the time, we created space for the intermediate care beds. At the time, we even have a tent. So we need to differentiate. So what we're saying now is about currently we have added other intermediate care beds in some of the existing hospitals. And then we realized that there will be a shortage, which is what Dr. Cloete was trying to explain. But noting with the trauma and violence, it means people will need acute care bed, not necessarily intermediate care, meaning the whole package, not only for COVID, but also for emergency and the trauma and all of those. So therefore, it makes it reasonable to have these beds attached to an acute hospital. So whether it's a specialist physician or is a trauma specialist who can be able to go and have a look at the patient when it need, not necessary for the patient who might also have a COVID. So we need to understand that part, that a hospital bed is named according to what it's supposed to function, and also what type of healthcare intervention and what type of a healthcare professional supposed to be taking care of that patient. So at the time of the CTICC, it was the time that the Bracken Gate, the Heracombe, and the Sonstral, and also we also in some of the district hospitals, we added about 20% of some of the beds for the COVID that also can cater for the critical care space. So we need to differentiate in terms of what type of the beds, not only just to think that it's only about the numbers. A bed is named according to a package that it offers for a duration of 24 hours, and what type of health professional must be able to provide a service for that particular bed. With the trauma, it means that we need more of the trauma beds than intermediate care beds. Thank you.
Thank you very much, Minister. So now just going to hand over to Vanessa's question. Vanessa asked, how severe is the constraint on COVID-19 testing facilities and centres in the metro and province, and what measures are in place to mitigate against this? The question was directed at Dr. Cloete.
Thank you, Kayla, and thank you to Vanessa. Yes, the capacity for testing is constrained, and it is normally when you move towards a peak, it becomes more and more constrained. So as we are moving towards that, and you could see as more ill people present themselves, the testing then becomes more important because you need a quick turnaround time on the result for people that are already got symptoms of shortness of breath. That's the people we call persons under investigation that presents to a hospital short of breath, needing oxygen. So it's more important to actually shift our focus to test there and to get the result back as quickly as possible. So there's an entire testing ecosystem that gets put under pressure the more cases there are, and therefore the more people presenting themselves to be tested. That's why prioritization then becomes part of a clinical decision making, to say it's better to test the people that's already ill, that requires oxygen, that comes into facilities. The second thing is to test healthcare workers, because you need to know whether healthcare workers are infected or not. The third thing then is to test other essential workers and to test the people that's more vulnerable. So therefore, age and comorbidities start playing a role. So as the capacity gets constrained, we take a very, let's call it a very stepwise and a very rational approach to limiting the pressure on testing. Our big message is that the people that are younger, that are exposed, that has symptoms, should self-isolate, and where somebody is at risk, they need to present themselves at the right place for testing. But the people, the healthcare workers, is currently managing the capacity by streamlining and making the right calls for everyone. Thank you.
Thank you, Dr. Cloete. Unfortunately, we have run out of time for our question and answers portion. So I'd like to request any members of the media who still have questions to please send me an email, and then we'll get that response to you as soon as possible. So as we're moving into our concluding portion, I'd like to hand over to Premier to make some concluding remarks. Over to you, Premier.
Thank you very much, Kayla. And once again, thank you very much to the members of the media and to those citizens who've tuned in today. I think specifically right now, this is so very, very important. The outline of where we are at, the fragility and the pressure that is on our health system right now is going to need every one of our absolute focus. We need to make sure that we're all playing our part. I've said this all along. It's about this deal between citizens and government working together. Here, this deal is about us as citizens playing our part to protect those frontline workers who have been dedicated days and nights into making sure that our loved ones who are being looked after in our hospital system get the best treatment that they can get. And as we continue towards this peak, and what Dr. Cloete has shown us, the next 2 weeks really going to be critical in our system. These 2 weeks also make sure that we, number one, understand the health system is making very difficult choices right now in decongesting the system, in making sure that they are creating those extra beds that are needed. And that means they're having to say no to so many things. Already just by doing that is putting pressure on them. We all need to play our part in making sure that we're helping to reduce the trauma component of the ask on our healthcare system. That is where alcohol abuse comes in. That is where the use of alcohol comes in. That is, we measure it, but that is where every one of you have to play your part. I think about a call late Friday night as the law enforcement teams were out across this province inspecting many of those places that are where alcohol is available, and just having that discussion with those law enforcement officials, just understanding that citizens were not wearing their masks, were drinking too much. All of those activities put huge pressure onto our system. Please, we need you to play your part. Those road traffic accidents. I was up in the Garden Route last week. I was up in the Overberg last week. And just noting how people are driving on our roads, overtaking on solid white lines, really not adhering to the rules of the road, putting yourselves at risk, and again, adding extra risk to our trauma beds in our hospitals. Please, we need to make sure that we reduce the trauma risk within our system. We can hear the pleading coming from our healthcare workers. We need to tell them that we are there for them and we are playing our part to make sure that we're reducing that risk. We need to also make sure that we play our part this festive season around gatherings. Make sure that those gatherings are small. Let's have them outside. Let's keep them within our bubble. At the very most, have 2 bubbles together. But you know what it is now. Please reduce that risk. Outside, 18 times less chance of infection compared to inside. The studies show us that. Please make sure and restrict movement where possible. Only go out when you need to go out. And then lastly, just follow the rules. Wear your mask and wear it properly. Make sure that you've got social distancing. Hand sanitize. We all know what to do. Let's all play our part over the next 2 weeks during this festive season so that we can give those health workers our love and support during this time, knowing that we are playing our part in this deal, knowing that they know that we care about them and understand the kind of pressure that they are under, and we will do every single thing that we can to give them that reprieve so that they can help us get through this together. Thank you very much.
Thank you very much, Premier. Thank you everyone for joining us, those who have joined us virtually and on social media. Let us adhere to what Minister Mbombo has said, what Dr. Cloete has said, and what Premier has said, and try and stay safe over the festive season. Thank you, everyone.
That's the Western Cape Premier Alan Winde there, giving an update on the coronavirus situation, of course, the second wave of COVID-19, then out in the Western